He was a clinician. When I remember back in the mid-90s, I was over the contracting, provider relations and quality management for the state of Oklahoma for Pacific Care, the largest managed care company. And Ray was one of our best providers in Oklahoma City area. This is not just a regulator or somebody telling you. This is somebody that's been there, done it, and done it well. And he's extremely knowledgeable about this field. So join me in welcoming Ray Caesar.
Thank you. I'm going to speak specifically to methadone treatment and opioid dependence. And a lot of things that the commission, actually I looked while you were talking, I looked up the waiting list yesterday was 685. So you're not very far from 700, and it fluctuates a little bit. And those are non-replicated requests. So we have taken out the duplicates where somebody will call 3 or 4 programs. So medication-assisted treatment is becoming, and that's one of the things I've been given responsibility for at the department. And I'm really happy the department is embracing medication-assisted treatment. We have actually even some new systems that we're putting in place that are using ambulatory detox for alcohol, for sedative, hypnotic anxiolytics. We already have that for opioid dependence, methadone treatment. We have 14 opioid treatment programs in the state of Oklahoma, including the one that's operated by the Veterans Administration. We have 3,700 patients in those OTPs. One of the things that Dan talked about, when you put somebody who's opioid dependent into the traditional treatment system, you will get about 5 to 10% lifetime recovery out of that group. And most of them will actually leave during detox. The detox gets so severe, so it might be that the second stage of treatment might work better, but we don't know because over half don't even get to treatment. They leave during the detox part of the intervention. Methadone treatment, 65, 75%, 80% success rate. Again, SAMHSA numbers, CSAT numbers, not just my opinion. Very successful medication-assisted treatment. We get folks, and one of the things when we look at just recovery in general, and this is one of the things that the commissioner talks about a lot, she didn't bring up today, but she just talked about a lot, with type 1 diabetes, there's a 30 to 50% relapse rate with people following through with what they're to do to maintain their health. With addiction in general, with chemical dependency in general, it's 40 to 60% relapse rate. And with hypertension and asthma, 50 to 70% relapse rate. So when people talk about chemical dependency, people that are addicted don't get better, they do get better. They are more treatment compliant than many of the folks that have other significant health problems. But when we look at opioid dependence, sort of the granddaddy of them all, again, we get down to some very, very low recovery rates. But if somebody comes to an OTP, and a methadone program is only for those with severe substance use disorders. You know, we talk about abuse and dependence. There are not opioid abusers in an OTP. One of the criteria for admission is that you are physically ill from withdrawal symptoms to be admitted. This is for people with severe, significant substance use disorders. 3,700 people that are being treated successfully in these programs. 3,700 people with some of the most severe dependencies that exist in the state of Oklahoma today. 3,700 people that we know, that SAMHSA says that we know, are typically chronic treatment failures in traditional treatment. 3,700 people that have been diverted from the traditional system that they would go through again and again and again, and are now here, stable and doing well, that are developing support systems, that are increasing their self-efficacy, that are feeling better about themselves every day, that are feeling less like failures, more like successes every single day. 3,700 people, and one of the things we get into, I did a year ago, 2 years ago, I went around the state doing an anti-stigma, a methadone anti-stigma presentation. Actually, at one of those, I was actually yelled down and wasn't able to finish. I had to leave I had to leave or start swinging, and I didn't want to swing. I thought leaving was a better option. The stigma is tremendous. Methadone is just trading one addiction for another. No, it's not. Methadone is different than any other opioid drug. When it's dosed appropriately, there is no euphoria. There is no sedation. When it's dosed appropriately, the individual, once they reach stabilization, you can't tell if they have had their methadone. You can only tell if you withhold the methadone. To me, it's more like insulin or an antidepressant than it is like some abusable drug. Now, do people mess with? Of course. People, I talked about this yesterday. I had an uncle that we used to take to Norman all the time for alcoholism treatment. While he was down there, he would get an attendant, an orderly, to buy him pints and sneak him in. Does that mean that Griffin was not a good hospital? No. It means my uncle was a bozo that was not interested in recovery. You know, I mean, he only went down there because we would hold him to, I mean, he was an involuntary admission, so to speak, family involvement. The methadone treatment success is 3,700 people. Now, some people will be methadone maintenance for the duration of their lives. Other people, 2 years, 3 years, 5 years, 7 years, will titrate and withdraw and go drug-free. That's a patient decision. It is not up to me to be saying, you need to do this or you need to do that. That's an old medical model that went out in the 50s, that paternalism model. Patient decision. Maintenance, titration and withdrawal. And some people appear not to be able to titrate and withdraw. When they do so, the cravings remain. They don't reduce. They don't go away. We've had some tragedies with that in the state of Oklahoma and around the nation with people that were forced by other systems to titrate and withdraw. Methadone treatment is viable. The biggest problem for me with methadone treatment is all the successes, and those of you who work in the clinics, you know this, all the successes are invisible. You never see them. They're not going to show up on television. They're not going to show up anywhere. There are 3 people in Alcoholics Anonymous in the Oklahoma City area now that have 10 years plus sobriety, that chair meetings, that have sponsorees, that are in OTP treatment. They're methadone maintenance patients. They have to lie and not tell anyone they're a methadone maintenance patient. Otherwise, they wouldn't be allowed even to speak in the meeting. I oversee the Oxford houses. We've had 3 people go through the Oxford houses in the Oklahoma City area that were methadone maintenance patients and lied. And nobody in the Oxford houses knew. 2 of them were successful, 1 was not. But that's still pretty good. This is, I am totally committed to methadone treatment. It works. I know it works. There are things we have to do to continue to improve it, and we are. The clinics here in Oklahoma are very, they work wonderfully with us. We have had very good successes. I have notes here that just keeps me brief, and it's not like I'm going to go on. So, but, again, 3,700 people. 3,700 people that aren't in residential beds, that aren't in detox beds, that are working, that are back with their families, that are back in the community, that are successful, that are doing the deal like everyone else does every day. This is a wonderful system. The other thing, the last thing I'll say, and one of the things that we know, all the methadone treatment in the state of Oklahoma, with the exception of Veterans Administration Hospital, is private for profit. Patients pay for their treatment. Looking at this, and SAMHSA has done these studies also, looking at this in states where you have mixed systems, public and private, or comparing states with public to states with private systems, we know that for everyone we have, every individual we have in treatment in Oklahoma that can afford to pay for methadone treatment, we have 2 that need it that can't access it. So we've got 7,000 folks that are still out there. So we have work to do. I appreciate all you guys are doing. I appreciate the interest. This is wonderful to see the interest. It's also wonderful to be able to get up and talk about methadone, and no one has thrown anything at me. No one has yelled at me. This is great. So I really appreciate. I have some cards here. If anybody has any questions or wants any information, it has my old title on there, but that's okay. The phone number, the email, everything else is correct. I'm over all the DUI services, so if you try to contact me, email me, because I'm probably on the phone being yelled at by someone who thinks they shouldn't have to go through all the stuff for them to get their license back. And I return emails while they're yelling at me because I don't give a lot of credence to most of that information. So anyway, thank you again.